Have you ever heard of a life-saving kidney transplant turning into a life-threatening nightmare? Because of a hidden parasite? Let me tell you about a case that's making waves in the medical world. A story that starts with hope and ends with a shocking twist. So, picture this. A 61-year-old man gets a kidney transplant. Everything seems okay at first, but 2 months later he feels terrible. Fatigue, vomiting, constant thirst, and he can't stop running to the bathroom. Suddenly, his condition nosedives. Low oxygen, fluid in the lungs, and he's rushed to intensive care. What went wrong? Doctors at Massachusetts General Hospital are baffled. Then, Dr. Camille Cotten, who specializes in infections after transplants, notices something strange. A big spike in a certain type of white blood cell, plus a reddish-purple rash on the patient's abdomen. That's when she starts to suspect a parasite. After a bunch of tests, they discover worm larvae in the patient's lungs and stool. The culprit? A sneaky roundworm called strongyloids, which is common in certain tropical regions, but not something doctors usually screen for in kidney donors. Here's where it gets even crazier. The organ donor had lived in the Caribbean, an area where strongyloids is pretty common, but no one tested the donor for this parasite before the surgery. Only after the recipient got sick did doctors go back and find the donor's old blood samples. Sure enough, antibodies for the parasite were there. And get this. The person who received the donor's other kidney, they got sick too, with the exact same infection. Thankfully, both patients survived, but only after some super special medical maneuvers. The doctors had to use ivermectin, a medication usually taken by mouth. But because the patients were so sick, they needed to try something different, injecting it under the skin. They actually had to get special legal approval from the FDA just to do this. Talk about thinking on your feet. Now, this story has led to a pretty big change. The United Network for Organ Sharing, basically the group that sets the rules for organ transplants in the US, has updated their guidelines. Now, they recommend testing all organ donors from high-risk areas for strongyloids before transplants. So what's the takeaway? Organ transplants save lives, but this story shows how even the smallest details can have a massive impact. It's a reminder that medicine is always evolving, and sometimes it takes one wild case to change the rules for everyone. If you found this as jaw-dropping as I did, hit that like button and don't forget to subscribe for more surprising true stories from around the world.